Hi there. Welcome to my live cast today, and I'm so excited to be here as usual. October is Breast Cancer Awareness Month, and so I wanted to talk today a little bit about some things that you could do for yourself in order to either uh, uh, prevent the possibility of cancer and also what diagnostic tools are available to you. So here we go. Um, some statistics for you first. In the United States, breast cancer has the highest mortality rate of any cancer in women between the ages of 20 and 59. This is from the breast cancer website. The American Cancer Society predicted that in 2021, almost 300,000 new cases of invasive breast cancer would be diagnosed in women and maybe 2,600 for men, with 43,600 women and 530 men expected to die from breast cancer. So there's a lot of terrible statistics here. In recent years, incident rates have increased slightly by 0.3% a year. It was really between 1973 and 1998 that breast cancer incidence increased a lot more by 40%. I'm Dr. Shiroko Sokitch, and I'm an MD and an acupuncturist and a certified functional medicine practitioner. And I'm also the author of a best selling book, um, Healing When It Seems Impossible. Thank you. So, I'm going to give you some tips for how to diagnose, and here are some of the tools for detection of breast cancer. And self exam is something that is highly recommended, and one of the things that I like to teach my clients to do, and I will tell you about that a little bit more. Of course, then once you've done a self exam or you have a suspicion, then you need to do your physician needs to possibly do an exam. And right at this time, mammograms are the recommended diagnostic tool. We are supposed to schedule a mammogram at least every 2 years. But there are other tools as well. There are MRIs, which some people's insurance will cover. You can also have an ultrasound. If you tend to have dense breasts, an ultrasound might be a better way of looking at them. And once a lump is isolated or some form of biopsy is needed, then you would have a needle biopsy to figure out what the lump might be. And thermography is another tool for diagnosis. And this is kind of a more controversial one that um, thermogram is using a scan that detects heat. So you have to dress a certain way, eat a certain way, and get prepared in a certain way. And it's non-invasive. It doesn't squish you. It's not outrageously expensive. And it's one way to sort of look at the health of your breasts and to see if there's any areas where there's a lot of heat or a lot of activity. That's how thermography works. The problem is that most medical doctors will not base their diagnosis on thermography. So if you found something with a thermogram, then you would have to have some other method of detection as well, either an ultrasound or mammogram or an MRI, in order to get a diagnosis if there was such a need. So, breast exams is a really great way of doing your own self care, and I recommend doing this actually every week or so, or at least every month. Here are some signs that you should watch for. Like one of the ways to do a breast exam is to stand in front of the mirror and to look, and I see that my face is blocking your thing here. So I'm going to take my face out of the picture here. Let's see. There. So here you go. So you can look at your own breasts in the mirror and see if there's any lumps or any abnormalities, any dimpling. If you have pain in your nipples or pain in some particular area, you should look at it more closely. If your nipples start looking funny or change in their appearance, you should get an exam. If there's changes in skin texture or there's changes in how they feel overall. That's another thing. Or if there's swelling on one side and not on the other side. There's many, many signs that our bodies give us in advance. I had one patient years ago who she actually had an intuition. Actually, this is not uncommon. She had an intuition that she had something going on. And so she went in and got a mammogram. It turned out she did have breast cancer. So there's all kinds of ways to think about this. But if you do your own breast exams consistently and you really get familiar with how your breasts feel and look, that is your most sensitive sign. It's one of the things that I teach people is to listen to your body. And so if you really pay attention to your body and to what it's telling you and to what it's doing, it's a very helpful piece of information. Now, there's some tips for prevention that you can follow, and it's really, I think there's another one there. Yeah. So there's a lot of environmental toxins, and one of the ways that one of the reasons that we have such a high incidence of so many different cancers is because of the chemicals that we're exposed to all the time. And one of them is fragrances. So one of the things to look for is companies that fully disclose their ingredients. There are fragrances that are safe to use. And in the slide deck here, these are all links. Clearia, Think Dirty, and EWG has a thing called Skin Deep, where they look at the ingredients of not just fragrances, but all kinds of products, house products, skin products, all kinds of things, and look at the safety of those things. Doesn't mean you can't wear any scents, but you want to be careful about the ingredients of the products that you use. And there's a lot of political activity now to help women or to help all of us have safer, cleaner products. The other thing, of course, is to eat organic fruits and veggies and locally sourced foods. It's not only good for your health, but it helps reduce emissions and waste. If you buy local food, to reduce the distance from farm to fork, and if you buy organic food, you'll keep your body and your environment free of toxic pesticides, of course. But also, one of the things that I've noticed, like where I live in a housing HOA kind of community. And I've seen the guys go around spraying the public land with Roundup to kill the weeds. And you want to, if you live in a community where that sort of thing is done, you want to ask them not to do that. You want to see if there's a safer, cleaner way to produce or to spray or to keep weeds away when you're here we go, moving this again. When you're trying to take good care of your health, you want to stay away from chemicals as much as possible. Another way to do is, again, in your home, you also want to reduce the amount of chemicals that you're exposed to. And the dirt that comes from outside, the pollution, especially if you live in a big city, the pollution that comes from outside. I used to live on a corner apartment on top of Whole Foods and on a busy intersection. And there was, constantly traffic all day, all night. And the stuff that came in through the window at the time, I didn't have, is a long time ago, but the time I didn't have air purifiers. And now I realize I should have had air purifiers to keep all the dirt and grime away from my home. Because the exhaust from cars can actually become physical dirt in your home. So if you use a wet towel to wipe down surfaces in your home, just a damp towel, you'll get rid of those kind of dust rather than, using a duster that's dry, which will stir up the dirt. And of course, one of the things that makes it really simple is to take your shoes off at the door. And to keep your home clean by avoiding toxic chemicals that you could track in with your shoes. Not only chemicals, but like what if you stepped in grass that's full of, that's been sprayed with Roundup, or dog dew, of course. And So if you keep your shoes off in the house, it's such a simple way to keep toxins out of your home. And then plastics. Now, plastics are really, so it's very common. A lot of moms have called me in recent years. Their daughters are having their periods early, like at age 9 or even some at 8, because they're being exposed to synthetic chemicals that have an estrogen like effect. And this is a danger for us who are trying to prevent breast cancer. You want to stay away from plastics because they can leach harmful chemicals into your food and beverages. And you want to use glass or ceramic or cloth containers for the food that you buy. One of the things I've noticed is, when we buy meat at the grocery store, it's always wrapped in saran wrap, which also, because the fat in the meat absorbs the plastic from the saran wrap. So if you can go and get your meat wrapped in paper instead, that would be better. And of course, we say BPA free, but BPA is no longer the only, like any plastic really isn't particularly good, because BPA, all the different kinds of plastics seem to have some harmful chemical effect on our bodies. So you want to make sure that you don't have that. And stop using disposable plastics. This is, of course, also better for our planet, but single-use plastics like bottles or bags and straws, and they can leach harmful chemicals into our food, especially when you touch heat or high fat content foods against plastic like that. Then the plastic will absorb into the food, and then you're drinking or eating that food. So I know sometimes it's not avoidable, so I'm not saying to be a fanatic. I'm just saying be careful with your exposure to plastic, and as much as possible avoid it. And then you want to read ingredient labels. And there's a breast cancer prevention partners website. This is the link right here, and it's also here, this glossary of exposures, where you can learn about what chemicals and substances are most strongly linked to breast cancer. And then you can do something to prevent yourself from eating those foods or from kind of getting exposed to those foods. And then one other thing is, when you handle paper products, some of those products have chemicals on them. So like if you go to the store and they have a receipt that they give you, those are coated in BPA chemicals. And when you get an airline boarding pass, also coated in BPA chemicals. And touching them can be another toxic chemical exposure. So as much as possible, you want to avoid touching paper things that have been coated in BPA, like gas pump receipts or store receipts or boarding passes. And you want to change to online billing as much as possible. Skip newspaper, because newspaper also has chemicals in it that are bad for your body. So just as much as possible, you want to avoid chemicals. Did you know it's perfectly legal for companies to put cancer-causing chemicals in our products? There's an action center with the BCPP website, Breast Cancer Prevention Program website, and you can help make a change for that. There's a lot of action going on, especially in California, about this at this point in time. Here are some websites that are helpful, and you can, I can put a link to this in the chat as well, so I can do that for you later when I'm done with this little chat. So there's many websites. EWG.org is one of my favorite websites. It's Environmental Working Group, and it has lists of foods that are potentially harmful, so that you can get foods that are, I'm sorry, not foods, also foods. So the Dirty Dozen, the environmental, or so skincare products, home care products, all kinds of things. that if you use cleaner, one of the things that I've noticed a lot is the laundry detergent. And we wash our clothes in laundry detergent that has toxic chemicals in it. And then we dry them with those dryer sheets. And that smell is a chemical scent that is also not necessarily good for your body. And then you put those clothes on your body. Same with when you go to the dry cleaner and you have your clothes done, um, washed or by the dry cleaner, and then you get them home and they smell like certain chemicals. Well, there are dry cleaners that have clean products, and so you should be paying attention to that, not just for preventing breast cancer, but kind of for preventing all kinds of cancers. I have a friend whose name is Dr. Carol Laurie. She's an MD and or a naturopath and an acupuncturist, and she has a free webinar here about recurrence. If you've had cancer, she has a program called Empowered Against Recurrence. Also, I've listed some complementary therapies for breast cancer. So I find that the most effective way to deal with almost any kind of cancer, but in particular breast cancer, is to combine different therapies. So you follow the conventional, whatever treatment is recommended if needed, but then also to use complementary therapies like acupuncture, um, optimization of your immune system, and treatments like that that will help you be stronger and healthier. I want to mention just one other little thing, and that is that stress and our emotional stresses and traumas are vitally important to our well-being as well. And so, especially if you have breast cancer or have had breast cancer, um, it's important to really to find a way that helps you feel happy in your life and to feel good in your life in a way that supports your well-being and your health. I have one person that I know who's a client of mine, and she got breast cancer a year ago. And she did all of the things that she was supposed to do, plus some alternative things that I advised her to do. But then on top of that, since then, she has made new decisions in her life about how to be well. And she's decided to go traveling more because she wasn't traveling very much and she wasn't really doing things that were making her feel really great. And so now she's off to Europe and she's traveling around in Europe and she's really just doing things that allow her to enjoy her life more. So the most important thing here, my voice keeps disappearing, sorry. The most important thing here is to find joy in your life wherever you can. And I wish you all the very best, and I hope you have a wonderful day. This is Dr. Shiroko Sokitch. Have a wonderful day. Bye.